So the advantages of doing minimal invasive surgery include one, post-op recovery is a short duration of time, so patients are able to be discharged within a short duration of time. Again, anything to do with invasive surgery usually comes with sometimes complications of the wound, so that we're able to avoid when we're doing minimal invasive surgery, because we make very tiny incisions, say a centimeter or 2 centimeter. Therefore, there is a lot of advantage when we come to minimal invasive surgery, including even post-op recovery. It takes a shorter duration when you do these minimal invasive surgeries, and generally the outcomes are very good. Here in Embu at Imara Hospital, we have this novel practice where we are doing minimal invasive surgery in various fields, including one, orthopedics. So in orthopedics, it's called arthroscopy, and in arthroscopy, we access the joints. The most common ones include the knee, where we're able to do diagnostic arthroscopy. Then we're able to do therapeutic procedures, including ACL reconstruction. ACL is just anterior cruciate ligament that is commonly torn. There is also a posterior cruciate ligament that sometimes is torn, not so common. Again, other common injuries we see in the knee include meniscal injuries, meniscus, and you can have some conditions of the knee, including inflammation like synovitis, where we need to put a scope inside the knee and do corrective procedures. For arthroscopy, again, other areas where it is commonly used include the shoulder, the hip, the ankle, and basically you go through the knee or these joints, and you're able to access the internal structures and do the procedures that are required to be done through this minimally invasive surgery. For other disciplines that the machine is used include gynecology, where they're able to do, again, minimal invasive surgery, including operations on the ovaries, whether removal of cysts or, largely most of these procedures that will be done invasively can be done with the use of this machine.
So in terms of comparison from what you would traditionally, how would traditionally do surgeries is one of the best things about laparoscopy. It has enabled us to make diagnoses even where we wouldn't have made a diagnosis. And this includes things like endometriosis, which is a condition that is quite difficult to diagnose through normal imaging like ultrasound and so on. It has also enabled us to be able to do surgery more easily in terms of advanced surgery, complicated surgeries. They have become much easier. There is also an advantage whereby the fact that you're not making large incisions and going through damaging many structures, and the healing is better, and that is a very huge advantage, and that's why the patient is able to go home early, or even within the first day, within the same day of surgery, they're able to go home. Another huge advantage when you look at healthcare costing, there is reduced hospital stay. So you have a patient only spending a day or two in hospital, and that has reduced greatly the cost of healthcare in terms of patients.
In urology, there are two main approaches to minimally invasive surgery. We can either do endourology, where we use a probe, that is a camera and some working elements or working tools to insert through where your urine comes out from. That way we can access any conditions that can cause any diseases that are either obstructing the urinary outflow or things that maybe can be growing within the system, like you can have an enlarged prostate, you can have a bladder pathology such as tumors or even bladder stones. You can also have kidney stones, which through your urinary system we can access them through those probes, and that way we're able to get either diagnose the problem or even get and diagnose, treat, and yeah, sometimes completely clear of the entire pathology. We have dealt with quite a number of cases, maybe around 20 to 30 at the moment. And most patients, or almost all the patients, report good outcomes. We don't keep them here for long in the hospital. As soon as we have done surgery, within a day or two, we let them go home, and they report quite significant improvement in their quality of life.
Nilikuwa kwa mchezo wa Nakuru tukicheza netball intercounty games, nikaanguka nikapata fracture ya mkono, and then I had a ligament tear, nikaenda outspan Nyeri, nikafanywa MRI, then they kept me waiting, ndio nikapatana na Dr. Kaburu. She's a good friend of mine. Akaniambia nikuje nione daktari wao surgeon. Then it was on Saturday. On Friday she called me, nikakuja nikaona Dr. Matu, akanibukia theater. Nikakuja ikiwa it was on Tuesday, nikafanywa Thursday. Process was successful. Nilifanywa nikiona. Nilikuwa nimegandishwa halfway, then walikuwa wameniwekea screen. Nilifanywa nikiona what was going on. So my ligament, it was completely torn. Wali replace, juu ni replacement ama ni repair, walifanya nikiona, and it is not bad. I think it is the best. It's now 1 month ago. It's not bad. You can say I can walk. I'm on my feet. Hakuna uchungu mingi, situmii sahi crutches. Sina brace, I'm okay. Kidogo tu within I think 2 months nitakuwa completely heal.